I know we did a quick conversation recently, and that inspired me to do a more detailed podcast with you. Especially, you emphasized your concern around significant burnout you are seeing in doctors. Number one, you also expressed concern around how AI will manifest itself into creating new kind of stress levels in the patients that you see. So I thought it's a good opportunity to spend some time with you because you interact with so many people globally and in the hospital. So being conscious is the podcast, and what does it mean to be a conscious doctor, a conscious human, especially today in the age of AI? So we're trying to uh, ponder upon this one powerful idea of, is the future of humanity's intelligence or something else like consciousness, compassion, wisdom? So with that said, you know, broadly, maybe for the audience, you've been a surgeon, you've been a globally accomplished doctor across US, India. You've been an entrepreneur. You've been a great leader overall. Yeah, Dr. Gurnath, you've been an accomplished doctor globally. You've been a successful entrepreneur, and you've been a great inspiring leader to a lot of us. So, what do you, maybe tell us a story behind? I haven't seen a lot of doctors becoming successful entrepreneurs. Maybe a story behind you in terms of what got you to what you do today.
Ravi, thank you very much. Once again, this is the second time. I think last time we just very briefly met, and you had a sound bite from me. And I think you asked me to further reflect on this particular subject of somebody being conscious and what is happening in the world of medicine and the practice and the new doctors and variety of things, that the transformation that is taking place. First of all, I want to commend you for taking something like this, because very few times we find where people are in a mode of giving something back to the society, to our communities, to the next generation or to the younger generation. And it's very laudable, you yourself being an entrepreneur, a successful person, that you have come forward to dedicate something like this to take the people across the world and to see how best you can, help them in in kind of making their life more interesting and inspirational. I think you're giving me more credit than I deserve, perhaps, with all your accolades at the end of the day. So, from my perspective, if somebody asks me, what does a conscious individual or conscious physician, should reflect? I am more in tune with the word conscientious. Okay, so a doctor who is he conscientious? That's what we kind of in a conversation type reflect on that. Probably there's not too much of a difference. Maybe it's an adverb or a verb or a noun at the end of the day. Okay. A, a conscious doctor, is the one which I feel that who through his profession, which is a medical profession, which I feel is one of the most exalted professions, in the world, because it really takes a person of higher intellect. And beyond the higher intellect, it also calls for a person of extraordinary character. This is because you're serving, humanity, you're serving people to preserve their life and how to navigate in the best of health, which is the greater objective of being a doctor. So a conscientious doctor at the end of the day is one who engages with the patients, okay, on a plane that he is not just treating the disease, but he is treating the person. Sir William Osler, who is the father of modern medicine, he has a very beautiful quote that he said long time back. He said that a good doctor treats the disease, but a great doctor treats the patient. It's very profound at the end of the day. And just to piggyback on that, those of us who know is about the great poet, the writer, the biographer, Maya Angelou. Okay, she beautifully said, you know, people do not remember what you said. People do not remember, what you did to them. But people always remember how you treated them. Okay, if a doctor can personify and becomes an embodiment of these two things which I just illustrated, that when you're taking care of a patient, okay, it's not about the disease at the end of the day. It's about the person. It's about the human interaction. And as Maya Angelou also said, it's about how you really kind of, treat them, what you say, what you do. How do you call for empathy, empathization, which I always lecture and say that, the greatest virtue of a doctor always should be where he wears the empathy on his sleeve. And for a doctor that we wear this white coats that you see, we should be wearing that on our sleeve at all times. And often doctors mistake, between sympathy and empathy. Patients are not calling for sympathy. Sympathy is simply a reflection of concern, where empathy, at the end of the day, is not just simply a reflection of concern, but it's a reflection of caretaking and for the well being of the patient, that you're in tune with the patient, that you care. You care what he or she is going through and how best you can really allay, simply put, their anxieties, even at the level of the subconscious, as a matter of fact, what they're harboring. Many times we see these patients that come across to you, which requires patience on the doctor, listening to the patient, extraordinary patience, not just concluding within 30 seconds and saying that the patient is suffering from anxiety neurosis and referring them to a psychiatrist or psychologist and basically done with it or prescribing a medication. Okay. I think long and the short of it is that a conscientious doctor always engages with the patient, where he is a very keen listener, okay, where he understands the ethos and pathos of the patient, and then, comes to a conclusion about, what is driving the patient is manifesting a particular disease. If you can go to the root cause, many a times, you can truly solve that problem. And but unfortunately, the way in which what we are trained for, we don't put that into practice. We become different animals. Okay. In a world that demands so much from the doctors, to engage in numbers, commercialization, to push and peddle drugs, surgeries, tests, and which is always equated and measured in terms of, performance.
Yeah, I think in the age of AI, what do you see really? I mean, with the patient side as well as doctor side.
I think we need to have some historical perspective of human society. Okay. We have gone through, you know, through ages, the agrarian revolution, the industrial revolution, the internet revolution. And now we are stepping into a new revolution of artificial intelligence or computational physics or quantum physics and all of these things at the end of the day. So, transformation and change is always very difficult. It is difficult for an individual, for a family, for a community, for a region, for a nation, and for the world as a whole. So, anytime there is transformation, and especially a transformation that is happening with extraordinary rapidity, that completely upsets your ecosystem. So, I feel with all this buzz about artificial intelligence, it's not just the healthcare profession, but it's across all professions in the world. And basically, it is something that is encompassing our day to day living as human beings. Okay. So we are in the transformation phase and feeling the jitters, anxiety, to the extent that whether somebody would have a job tomorrow or not, and all of that stuff that we're witnessing. So, coming to healthcare, the way in which I look at it, if you calmly study this process, And AI is a black box in healthcare, a black box that is spitting out algorithms, which is helping to facilitate to faster diagnosis and better diagnosis on one hand. Number two, AI as a tool in healthcare would come to help you in decision making in terms of what is the right medication, what is the combination of drugs, what are the side effects of medication. So, if AI is conceptualized as an adjunctive tool to a physician rather than a competing force, then that embracing of philosophy will make this journey extraordinarily simple. And that's how I look at it. As doctors, there is so much of learning that we have to go through, which is a continual process. There's no other profession has such kind of a demand, particularly this extraordinary transformation in the medical field because of new research, new technologies, hundreds of thousands of studies that are published every month. So a physician has to continuously upkeep, and we have our limitations, especially in the world of oncology, the way in which this transformation is happening. We can't even pronounce those drugs' names. I myself feel baffled when I sit in the tumor board conference. What was it? I'm in a Sanskrit class, I'm in Greek, French, Latin. So, coming to AI, now AI will be a fantastic tool for you. It's like a physician assistant. You take off that burden, then what are you going to do with the time? That time you're going to spend with the patient. You're empathizing with the patient. You're touching the patient and explaining, you have breast cancer. Nothing to worry about it. Okay, you'll do well. You're comforting the family members. You're touching everywhere where there is anxiety or neurosis or, like hell is, basically the world is coming to an end at the end of the day. We all go through that, live alone cancer. But any disease that is diagnosed, it is not taken well. So instead of spending so much of time for us, if there is a tool for us to help navigate these things, then as a doctor, you can discharge your obligations, on a broader platform, engaging your patient. That's where your think about being conscientious and attaching to the patient is what makes a difference. And look at Florence Nightingale. You know, Florence Nightingale was basically, I would say, medicine was born not by the discovery of drugs from Alexander Fleming and penicillin, all of those things. The Crimean War has shaped the world of what care is, what compassion is, what empathy is. A woman was born in a very rich family, okay, who completely abrogated a lifestyle, okay, and went in to serve the war victims, so soldiers who were wounded, amputated, with gushing wounds and all of those things at a time when there was no question of how to manage sepsis, how to dress them, how to comfort them. Okay, that was the beginning of an era of not only taking care of the people, but what does empathy, love, kindness, caring for somebody was the initiation of what truly healthcare is, which defined not only the nursing care, but truly defined the physician's care. Although, as doctors, we don't want to acknowledge that. We only glorify her as, the woman who gave birth to nursing. But this is the woman who gave birth to, what really healthcare means at the end of the day.
Great point, because they over last 2 decades, at least from the time I've seen many, I've gone personally into engineering, but my wife is a doctor, and I see exactly what you're trying to say. What's the role of a doctor? But I also see a significant amount of stress and burnouts in the doctors today, and uh, my kids are at that age, right, where they've now graduated, but I see a lot of Gen Z kids and next generation that are asking a question: is this getting into medical profession? Is it for me? And from where you see, from your vantage point, who should really get into being a doctor going forward in everything that is happening in the world today?
I think this is truly a self inflicted wound on this profession by corporate greed. I can just summarize that. Okay, we all know of the good old doctors couple centuries ago, where there was a doctor in your town, in your village, you served the patients, and for which you were not paid. You were given, you know, basically a bag full of vegetables or rice and all of those things and whatnot, which was extraordinarily satisfactory in how much they loved the doctor. So not only served, became a doctor, but become a friend, philosopher, and a guide in that community. That has transformed completely. So what is the transformation? On the day healthcare was coined, it's business beyond a profession. That was the beginning of the death knell. Okay. And then what is happening in today, the 21st century? For example, in America, 80% of healthcare is corporatized. Doctors and physicians who are having a private practice, they have to give up. And this is a true statistic. Barely 20% of the private practice prevails. Now, what did this do to the profession? So when doctors are working in a finite hours, like as if you're working in a factory or an industry, where you go at particular time swiping your card and the clock, and then you're living at the whatever the defined time is, you know, and then you're expected to perform and generate so and so. The same thing is happening with the doctors because you're given time slots, 20 minutes for a new patient, 10 minutes for a follow-up patient. You're supposed to see 15 to 20 patients if you're an internist. If you're a specialist like me as a gastroenterologist, same numbers come into place. Now who define all of these things? All of these things have been defined by a corporate business mechanism for making the business successful and profitable. So we are profiting at the expense of somebody's, disease, ill health, all of these things. So we have transformed that patient into an object, basically, or a number, putting the pressure on the deliverer of healthcare. Unless you do and perform this, okay, you may not have the job, and that's truly happening. There are situations where doctors have been eliminated because they can't keep up the census. Now, how is this possible? A new patient for 20 minutes. For the first time you're seeing, the patient is 45-year-old, okay, and the patient has been told that your blood sugars are high. Now, by the time you take the history of the patient, even by your assistant, everything entered into the system. Today's world is that, you're more busy with a keyboard or dictating something that is digitized rather than asking questions to the patient and yourself asking taking the history directly. So within 20 minutes to extract the complete history of the patient, then the family history, which is extremely important, the professional history as to what impact it has on the new onset of the disease, whether the patient is sedentary, leading to overweight, obesity, the patient is a smoker, the patient has family discordance, the patient has sleeplessness, the patient has other bad habits. All of these things are such an impact to modify the disease and the journey rather than just writing a pill to manage the diabetes or manage those blood sugars, and that is what is happening today. A tremendous disservice to the patient where we don't engage them to address the disease from the grassroots, but just put a band-aid, finish off the 20 minutes because you're worried. Your performance is strapped. Okay. So every facet of the doctor, when it is measured, and you have to be in that box at the end of the day, that is the major change which has happened in this profession. And that is, we brought this on to ourselves. If the original sanctity of this profession is brought back, I think humanity will be better served. Doctors will be more at peace and relaxed to do their best. Okay, the whole issue about what we are talking today about increased suicide rates, high depression amongst doctors, higher mortality among the doctors, stress among doctors, the so-called phenomenon of burnout among doctors. I think that go through a change. But how is it going to happen? Anywhere there is industry, and industry stands for profit, So that's a major problem today, and which is also happening in a country like India. Now, I transitioned here to give back to my country and built this phenomenal tertiary quaternary care hospital with the very high altruistic purpose of serving the people at the end of the day with the best of the doctors on an ethical platform, practicing evidence-based medicine. Okay, somebody would call it, they told me that at the beginning of my journey, you'll fail. Okay, you'll absolutely fail. And probably they were right, but I think I thank to my parents giving me a strong DNA. I said failure was never my option. So I navigated, established, yes, accumulated good group of doctors. But what is happening is India is going to the same transformation. The doctors want, more money. They want to be less responsible. They want to finish off things at a faster rate, that they see this, if they do certain things, which has a multiplier effect, they can earn more money. And you'll be very surprised, Ravi, that Indian doctors are, in certain specialties, earning more than in the US. And this will be a shocker when I talk to my colleagues also in the US. Feels like neurosurgery, orthopedic surgery, and even medical specialties, cardiology, interventional cardiology. And several of these specialties, they're almost on par or even earning better than that.
So, what was your deeper purpose behind building such great institution like Continental Hospitals with all the success you had accomplished in America? I mean, you're pretty up there in the world, but for you to take this kind of mission, I mean, India is not an easy country to operate with so many corporate hospitals coming in, money pouring from various private equities. You came in a time where and you have been off the country for many, many years, so there has to be some deeper purpose. So what is that?
Well, I think because of the brevity of time, I'll just quickly summarize, okay? As a young student here in India, I was fortunate enough that when I could finish my 10th grade, I was state second, received the state special merit scholarship that helped me to go through my junior college. Then again, I received state merit scholarship that helped me to finish my medical school, all for free, okay? And it's not that my father could have paid the tuition, but I was extraordinarily grateful. So because of the scholarship, the government educated me, okay, being on the top of the class, university first, all these things. When I went to the US, then after a couple, 2 decades or so, when I reached the peak, in the sense, in my own dimension, that both professionally, in the top echelons of my specialty, then also in organized medicine, I have served in various capacities as a president of Houston Academy, president of the Medical Society, president of Hospital Council of Chief of Staff, delegate to the Texas Medical Association. So many policy makings, first chair of the International Medical Graduate Section. So when I reached that, I said, listen, I've been successful, I've been earning, okay, but there was some guilt that really came in, which is somebody educated me, okay, what should be a moral compass? Can I in any form give back? Yes, a lot of people who are successful, in the US or elsewhere, they do help. They associate with, in the form of various contributions, donations, and foundations, and involving in aspects and whatnot. For me, that was not enough. Why? because every other year I used to travel to India. I was watching healthcare in close quarters. When I used to take my parents to doctors, the so-called highly placed doctors in the society, because India had the biggest craze of the doctors with the highest names. Everybody wants to crowd with only that one doctor in that specialty. Okay, but when I see that the doctors are spending a minute or two seeing 100 patients, 150 patients, and the patient does not know writing on a piece of paper, he can't even decipher what is written, and we don't know what next to do when he steps out of the chamber of the doctor. All of these things have a lasting effect on me. I think there should be a better way to practice healthcare. As we as Indians deserve better. And then the whole talk about in the 1980s, 90s, and all of these things, 2000s, the amount of corruption, the amounts of violation of ethics, and all of those things that I was hearing about it. I said, can I, in my own dimension, contribute to some extent to change this, bring some changes? That was my biggest challenge and motivation. Also, I didn't have any endorsement from anyone. No friends really kind of supported me in the sense, not for monetary, but my idea. And that was the biggest deterrent in the sense, would I really succeed? When not a single soul came forward, I think you're a fool enough to give up everything and do something like this. But that was truly an inner call, a challenge, and the country needed. And whatever I do in my life, I do it with a purpose that basically not with an idea that this should be profitable. Okay, this is only doing for a business venture. No, the infrastructure of Indian hospitals was very bad. So I had 18 months of journey whenever I used to come every 6 to 8 weeks, then to study the Indian hospitals, the newer ones that were being built. What were the lacunae here? So all that stuff inspired me. The India needs first in place is that a proper infrastructure, international standards, where the safety, the dignity, and quality of the patients are always maintained at the highest level. And that's what today Continental stands for.
Absolutely. And congratulations for building such a wonderful hospital. We are actually here in your hospital. And you've become a role model for a lot of very accomplished American doctors who really want to come back and give back to this uh, to the place where they grew up in. And you are a true example of what a being conscious doctor looks like, right? At the end of the day, um, you know, what would you want? I know you're a grandfather now. And what would your grandchildren, what would you want them to remember about you?
Well, the only my expectation is that whether it's my children or grandchildren or nephews and nieces is that I led a life of purpose. All my life has stood for integrity, for ethics, compassion, and caring for one another. That's all I want them to remember for. Okay, I want them to enshrine these qualities in whatever they want to engage in life and whatever they want to pursue. It's as simple as that.
Fantastic. Three quick rapid fires. What is one habit that changed your life?
Hard work.
What's one book you would recommend to the next generation, the Gen Zs?
Well,
Or one book that you would recommend?
the book that has a tremendous influence, particularly being a doctor, that was a tear-jerking one, is Of Human Bondage by Somerset, which I read in my junior college or 11th grade. Till today, that has an extraordinary influence. What is the expectation of a patient when he's going through a diagnostic workup, the challenges, the wait time, the anticipation of results of a pathology, you know, and a little judgment or a call by the doctor is going to completely change the life of a person and the impact that it has on somebody. So I know you said rapid fire. I got into
Yeah, that's okay. We got what we wanted. What's one quality you'd recommend all leaders of future must have?
integrity.
Integrity. Fantastic. Thank you so much. Thank you so much. It was
Wish you
so
all the
wonderful.
best. I think continue to engage this. The world needs you and your message, talking to people and, getting them to understand. Appreciate it. You have a safe flight. All right. Good. Thank you.